Hello and welcome. It's 11 a.m. here in Seoul. I'm Kim Mo-gyun at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in South Korea. And he will fill us in on the number of new infections as of midnight and the efforts that the government is making to contain the virus. Now, to give you a brief idea as we wait for the briefing, South Korea reported 470 new cases of COVID-19 on Wednesday, climbing back above the 400 mark for the second straight day. Of the new cases, 452 were locally transmitted and 18 were from overseas. 3 additional deaths have been reported, with the death toll rising to 1,648. Let's now turn over to the Sejong Government Complex.
As of today midnight, we have 452 new local infections and 18 new imported cases. And we had 3 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And here are some updates on our quarantine efforts. Yesterday, we have carried out testings, and we have carried out around 65,000 testings. And at the testing centers, we carried out 35,000 tests so far on a daily basis, and about 29,000 cases at the makeshift testing centers nationwide. And as for the medical capacity, here are some updates. We have 590 beds available for those who are critically ill, and we also have about 11,000 beds available for patients with mild and moderate symptoms, and we have 0 patients who are waiting to be admitted to hospitals. And also here are some quarantine measures, updated quarantine measures for migrant workers. First of all, centering around the communities of these migrant workers that are prone to further virus infections, we have set up makeshift testing centers, and we are carrying out massive testings for them. And moreover, we also ask all of the managers and also the companies that have the dormitories or hire more than 5 migrant workers, and there are about 12,000 of them nationwide, and we are asking all of them to also take particular precautions. And we are also looking at these workplaces, especially here in the metropolitan area and Chungcheong province, and we are also collecting samples whether there are any COVID-19 viruses that are present at these workplaces. And we are also identifying and monitoring these samples and analysis at these workplaces that are categorized as high-risk places. And if there are viruses that are present at these facilities, we will be carrying out massive testings as well. And we also have continued cluster infections breaking out at corners of the country, and we are carrying out epidemiological investigation. However, we believe that crowded and confined and close contact environment must have spread the virus in a large scale. So we ask you to always wear your face mask even if you are at your workplace, and also please wash your hands and also ventilate on a regular basis to reduce the risks of infection. Moreover, if you have fever or other respiratory symptoms, please do not go to work. Rather, please get tested at a nearby screening clinic as soon as possible. We also ask managers of these workplaces to also encourage your workers to get tested regularly, get tested on a swift manner as well. And moreover, we ask all of the workplaces and multi-use facilities to designate a responsible employee responsible for quarantine measures. The quarantine authorities are also cooperating with the government institutions, and we are also providing training sessions for the workplaces quarantine measures that are necessary. And we are also devising tailored guidances and guidelines for these multi-use facilities and workplaces, and they are also available through the government's COVID-19 website, as well as the Ministry of Health and Welfare. And also, we ask all of the workers who are working at multi-use facilities to also train yourself utilizing these data. And here are also some updates as for these COVID-19 who are under the COVID-19 treatings. And also, we are also seeing senior citizens and those with disabilities who also need to be hospitalized at designated hospitals and designated hospital beds if they are confirmed with COVID-19. We have about 900 beds for the senior citizens that need special care, and we also have about 400 beds at 8 mental facilities nationwide for those with mental illnesses. And we will also intensify these measures going forward, and we will also have specialized hospitals for those with handicaps as well. And we also have had a 12% on-week decline of the foot traffic of the people during the last weekend, and we believe that there was a relative higher increase during the first week of March because it was a long holiday. And while we are still seeing a high rate of foot traffic, we believe that this is similar to that of November's. And next, we also will be briefing you on the COVID-19 vaccination for those who need to leave the country for essential purposes. And these essential purposes include some government services as well as business trips purposes as well. And we have provided some procedures for COVID-19 vaccinations, and they include being dispatched for the military services overseas, and also being dispatched at other branches of the offices overseas as well. And also, we will also include these national service business trips under such a category. And starting from the 17th of March, we will also be receiving the applications for these necessary COVID-19 vaccinations through the related government ministries, and they will also be the inoculation will be provided through the public health centers. So if you need to get yourself vaccinated before you leave the country for essential purposes, please refer to the newly zipped documents that are available online. And as for the details, please refer to the press kit that are enclosed. Moreover, starting today, we will also be expanding the visitors for the nursing hospitals and care facilities, and we believe that this measure will be very welcomed by senior citizens who are residents of these nursing hospitals and care facilities. However, we also see a high risk of infection in these facilities, and even last year and until now, we have seen many people losing their lives due to the COVID-19, and we ask for you to comply with strict quarantine measures when you have to visit your loved ones who are staying at these facilities going forward. And the government will make sure that we carry out the compliance of the quarantine measures for all of the visitors to these facilities. And to this end, we will also make sure to exert our full efforts to return to a state of normalcy. Thank you very much.
And that was the government briefing on the COVID-19 situation here in South Korea. The nation reported 470 new cases of COVID-19 cases on Wednesday. Now, this brings the accumulated number of COVID-19 cases to over 93,000. We'll wrap up the coverage here. We'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.